Hello, my name is Andreas Kannenberg. I'm the Executive Medical Director for Ottobock in North America, and I'm presenting my poster Individual Responder Analysis of the International Randomized Seabrace Crossover Study. The International Randomized Seabrace Crossover Study was the biggest study that was ever done in orthotics with knee, ankle, foot orthoses, comparing the Seabrace to locked KFOs, posterior offset KFOs, and stance control orthoses. In the intention to treat analysis, we had 102 patients, and in the per protocol analysis, 69 patients. So we were asking ourselves, after the study had shown great improvements in balance, in reduction of falls, and in performance-based and patient-reported mobility, are there any indications that some patient groups may benefit to a greater extent or are more likely to benefit from the C-brace than other patient groups? So that's why we did an individual responder analysis of the per protocol sample of 69 patients. What we did there was we used the validated minimal clinically important differences and minimal detectable changes for the Berg Balance Scale, for patient-reported falls, for the activity-specific balance confidence scale, and the dynamic gait index to determine individual responders to the C-brace. And we did that analysis and compared the individual responder rates for polio survivors that were 35 of the 69 patients and patients with non-polio conditions that were 34 patients, as well as for previous users of locked KFOs and equal 23, and previous users of free swing KFOs, and that combined posterior offset knee ankle foot orthoses and stance control orthoses with N equal 46. What we found in the results was that patients with non-polio conditions and users of free swing KFOs were more likely to benefit from the C-brace and to benefit in more outcomes than polio survivors and blocked KFO users. So the number of full or partial responders of non-polio patients and users of free swing KFOs was about 85%, whereas it was between 60 and 70% for the patients who were polio survivors and users of locked KAFOs. However, the responder rates for polio patients and users of locked KFOs was big enough to say, well, we don't want to exclude these patients automatically from evaluation for C-brace candidacy. These patients, so polio survivors, especially if they have been using a KFO for decades, or patients who were using locked KFOs, need much more clinical scrutiny, much more thorough clinical exam and testing with the C-brace trial tool to determine whether they are C-brace candidates or not. I think that gives clinicians a good guidance that you can proceed with patients with non-polio conditions and users of free swing KFOs basically right away without long testing, whereas for patients who are polio survivors or users of locked KFOs, there is more consideration, more clinical consideration required. Please come to the poster room, view the poster in its full version for more details, and thank you very much for your attention.